Week 1 post shoulder surgery, I ended up getting a Bankart repair and a Remplissage. Long story short, that is to stop anterior, which means going towards you, dislocations that I've been going through for the last 13 years. So this surgery healed a dent that I had in the bone, the round part of the socket, and that's the Bankart, and the Remplissage putting the piece on it, and the muscle that connects everything, one of them, the labrum, I got that repaired as well, and the scar tissue cleaned up because it was quite a bit, because this has been happening so much. So I am a 40-year-old runner, and that is my sport of choice. I run just about every day of my life and lift maybe 2 to 3 times a week. I'm still pretty active, and yeah, so this is just hard for me. So I'm on my second walk since I have had surgery. My husband has been taking me places. Today he took me to the bookstore. Yesterday he took me to Whole Foods and Kohl's, just so that I can get some fresh air. And now I'm going to start trying to get my spirits back, my mental health, and keep my physical health okay as well. So I got 6 months. I have my follow-up appointment on Wednesday. I'm scheduled to go back to work on Monday. I'm looking forward to it, but I have not driven yet, so I don't know about the logistics of that. Once I go to my follow-up appointment, then I will be able to schedule my physical therapy. I am told that I have to go to physical therapy 3 times a week for 3 months, which is expensive. Not to mention, part of my surgery was not covered, so I had to pay $2,600 out of pocket because my insurance doesn't cover the Remplissage per se. That code, whatever, something about the coding. So yeah, how has the week been going? It's been a little rough. Day 1 was really rough because your shoulder is frozen, like you literally can't feel your hands or anything like that for the surgery, and then you are put to sleep, and then they tell you right away to take the pain medications. But I was awake while they were talking to me and Zach, and I wasn't paying attention, and Zach assumed that I was, and I didn't take them. So my first 24 hours was catching up with the pain meds. So that's my biggest piece of advice, is to take those pain meds as soon as you get home, because it is best to prevent pain versus to chase it, because that's a 24-hour chase. The next second thing I want to suggest was getting a stool softener, and start taking those actually before, right after the surgery as well, because constipation just makes it so much worse. I am on day 7 today, so I'm no longer on pain medications, and you have to be in this sling 24/7. So I don't even think I'm cleared to walk as long as I'm walking, but whatever. So just having those things for comfort that you probably will need. I have a Medcline shoulder pillow system. It is amazing. Your FSA dollars, if you have it, should cover it. And if you don't have FSA, it is worth out of pocket. Get you that 20% off coupon. Also, a portable bidet. And you're going to be using your non-dominant hand. So this one is actually on my right, which is my writing hand as well, which is another challenge that I have. So I did not practice doing things on my left side, which I should have. So I do advise you to be able to do that. I also advise, I'm not real big on the have meals prepared thing, because I am married and he can cook too. So we're kind of like dividing and conquering the cooking and things like that. But I am trying to make myself a bit more independent. There was a couple days that I was by myself. So just make sure that you watch videos if you are watching this and you're about to have your surgery. Prepare for the immense amount of pain, but it does stop, and every day is getting better. Where I stand today is I still have I get a lot of nausea. So I was prescribed Percocet and ibuprofen 800s, I believe. And they gave me some onidestrin because I am prone to nausea. And Mexiclam or something like that. And the M1, I wasn't supposed to have until yesterday. I took it one day yesterday and the day before. No, it was yesterday. No, yeah, it was the day before, the night before at midnight. And I was so dizzy yesterday. I thought I was going to throw up, and I don't like throwing up. That's my kryptonite. So yeah, I quit perks on day 3. They made me very, very woozy, very sleepy. They blurred my vision. You could literally feel the pain melting away, but it was very short acting. And you have to take those every 4 hours, and that's not me. So I quit the perks. I did a ibuprofen, but y'all know that's not good for the stomach. Like I just said, I got some gastro issues, so I don't really want to, aggravate that. So I'm just really relying on the ice. So make sure that you get yourself, they're going to send you home with an ice pack. That was really uncomfortable for me, but make sure that you get your own. Make sure that you get that Medline pillow, your portable bidet. You're going to get your stool softeners. Ask those questions. I also have high blood pressure. I had to have an EKG. I didn't do well on the EKG, so cardio, the heart doctor had to be in the room as well. But I had a wonderful experience with my doctor. He's really good. He really talked to my husband about it, because this was actually the second doctor that I chose, because my first one, I didn't like his bedside manner. But this doctor, he was good. As well. No, this doctor was really good. His office is really good. They're very thorough. They're working with me on different things, and especially with my the high blood pressure. And yeah, so I'm just not trying to have a setback. I want this to be my first and only and last surgery. This was my first time having surgery. I don't take no medications. I have no health issues. I'm just over 40 and I have high blood pressure. So that was just really something. He just aggravated the whole thing. But so far, it's been a ride. I'm looking forward to talking to y'all about it. Ask me any questions that you have in the comments. And yeah, until next week, we'll talk.